Every paramedic knows saving time means saving lives.
He's fallen, he's got an eye injury, they don't know how long he's been on the floor.
But across the country, our ambulance crews are facing their own emergency. We've gained exclusive access to the front line.
Do you know how long you've been on the floor?
As record delays prove deadly.
Ambulance service, is the patient breathing?
No, I don't know, but he's passed out now. I think he's very cold. He's very cold.
For this family, a long wait may have cost time with Richard Carpenter. When he collapsed while recovering at home from a heart operation, the ambulance took 5 hours to arrive.
He said, "Where are they? I'm going to die."
Are you breathing? Come on. Richard!
His wife, Jeanette, was left trying to save his life on her own.
1, 2, 3, 4.
Keep doing the rhythm over and over. Don't stop what you're doing, okay?
1, 2, 3, 4.
I was shouting at him, "Richard, Richard, don't leave me," and sort of patting his face, but I knew he'd gone.
I'm going to clean your eye, but it might sting a little bit. Is that okay?
Well,
Across the country, people are waiting longer than ever for an ambulance, placing huge pressure not just on patients, but paramedics.
What's it like for you turning up to patients who've waited a very long time on their own for an ambulance?
It's disheartening. It's draining. I didn't join the ambulance service to go to patients 9, 10, 11 hours after they've fallen. And often these older adults will end up being admitted to hospital because they've been on the floor for so long. When if we'd got there a little bit sooner, then they may not have ended up going into hospital.
A survey of 2,300 ambulance staff carried out for the Tonight programme by the GMB Union found 82% are struggling to cope with the stress. 85% have seen delays damage a patient's health, and 35% say delays are causing deaths. And this is just part of the problem. The NHS invited us to film at Warrington A&E, where ambulances queued outside because there was no space to offload patients inside.
Once they're taken off the back of an ambulance, this is the next queue that the patients join. They're lined up not just along this corridor, but all down this one too.
Our cameras captured patients head to toe on trolleys, just waiting to get inside A&E, including 92-year-old May, who has severe back pain.
How long have you been here for, May?
3 days.
3 days? On this bed?
On this bed, yeah.
Did you ever think you'd have to wait that long? Did you ever imagine that your 92-year-old mum would be on a trolley for 3 days?
No, not in a million years, no. Not happy at all. Mum has been in a lot of pain, but the nurses and the doctors here have been absolutely excellent.
May's delay is someone else's too. Paramedics tending to patients for hours outside full hospitals can't answer new calls.
We've already got 90 patients in department. 19 of those are on our corridor.
Labour say our footage is the worst they have seen.
I find that really quite difficult to watch because I was a care worker that looked after older people. That's someone's grandma, that's someone's granddad, that's someone's loved one that sat on the trolley, and I find it unforgivable that the Conservative candidates are not even talking about these issues because, quite frankly, it's not them that are having to face it.
As the candidates to be our next Prime Minister focus on the country's finances, what price will they put on the nation's health?